Hello, lab experts. Welcome to another episode of the RoK Diagnostics Podcast, the podcast where we discuss everything medical laboratory science in Africa and around the world. Today, we're going to travel a little. We're going to talk about what it's like to study medical laboratory science in the UK and also talk about what it's like to work in the UK, what it's like to study in Nigeria, what it's like to work in Nigeria, and we'll try and compare and contrast to see what are the differences between the systems. So without much further ado, let's talk MedLab. As I was saying earlier, today we're going to talk about differences between the system in the UK and that in Nigeria. We're joined by a medical laboratory scientist currently working in Nigeria, Hamida Koguna. She's going to talk about what it was like to study in the UK, what it's like to actually work in Nigeria, and she'll try and help us compare and contrast both systems. So I'll let her present herself. So, what can you tell us about you?
Um, I am a Nigerian medical lab scientist, but I had the privilege of studying biomedical sciences in the UK. And I have not worked in the UK, though I know what the system is like, but I have had the privilege of also having my entire career in Nigeria. So I'm able to pull the differences and the similarities between working here and working there.
And speaking about, maybe we should start with some similarities. What were those that you found in both between both systems?
The emphasis on practical application of the knowledge is what I found to be similar. However, in that similarity, also there are differences. Whereas in the UK, as an undergraduate, you would not be allowed to handle human samples and to directly interact with patients. There's a lot of practical aspects in it, but you're allowed to practice on human samples and interact with the patients.
I think that's really a theme in most of our countries in Africa. We're actually allowed to work with human samples, and it's actually encouraged. I guess over there, why are you not allowed to work with human samples? Is it due to ethical reasons or?
Yes, there are litigation things over there. I think they get really scared and they have to cover all their tracks. With students, there tend to be a lot of mistakes sometimes, and they try to overcome these issues by just not allowing the students to be in the proper lab at the time that they're undergraduates, so that nobody has to pay for any mistake. Whereas mistakes and the mistakes are rectified, and I don't think a lot of, I would like to think it's not that bad. I'd like to think we catch our mistakes more than we're allowed to. We're allowed to let them pass through the system with the results being faulty. As you probably know, with most Nigerians, the UK is like a second home, so it seemed like a reasonable choice. It was somewhere I was comfortable with. I had been to so many times. I had spent a lot of time in there, and I think it just came naturally that I sort of came naturally to opt for the UK. But it wasn't always my first choice. I had actually started studying in Nigeria, but I started MBBS, the medical degree. I found that it wasn't for me and I wasn't really happy, and I just dropped out and I refused to go to school for some years. So during those 3 years, I did a lot of research and I realized there are a lot of other things that you do that are hospital related that don't have to be a medical degree. So I opted for the biomedical science degree in the UK.
You'd started studying already a bit here. What were some of the differences just between the way studying was done here and then over there?
There was a world of difference. The thing that struck out to me the most was that as soon as I got there, I was registered as a matured student because I was already 21, and there were a lot of perks that came with being a matured student. We had a choice of accommodation. We had a matured student's room that you could go to relax in between lectures, because it gave me, it gave me a sense of belonging. I didn't feel like I was too old to be there, hence, retreated into my shell. And the second thing that struck me as really odd was that every student was assigned a personal tutor. So that personal tutor is like your parent away from home. They would check on your academics, and if you're slipping in any way, they would call you and ask you whether you had any problem, and they would rectify it to the best of their ability, even if it was not academic. If you had any personal issues or issues that were health related, they would be able to support you and send you to the doctor or to the psychologist or whatever you need. They were always there, and they were always checking on you, and they had your back and you didn't even know it. So that was quite different. That was, I really thought that was something that we could, bring back home. I think a lot of our students would be able to benefit from that. Some of them would encourage you to make an appointment via email. Others would just encourage you to drop in. So it all depended on whoever it was. And you maintained the same tutor throughout the course of your study, unless, of course, that tutor happened to leave the university.
Here, we always have different kinds of, as you must know, I don't know if it's the same in Nigeria, but for example, in Benin, like at the university, even your supervisor for your final year project, it's hard to get actually in touch with the guy whenever you want to do work. Like sometimes I've had people talk to me about situations where they've gone to meet a supervisor, and then from morning till 7, they didn't see the guy, and it's around 8 that he actually beckoned them into his office to talk for like 5 minutes, and then bye-bye.
It's the same scenario in Nigeria as well. I guess so, but I mean, every little bit counts. I think it would be, to our own advantage if we take our students under our wings and sort of just put them through. I mean, not everybody is going to need the help, but there should be help for those that would need it.
How about on the internship side? How were things over here? I know you said you didn't really do your internship there, but from what you heard from others, like, what was the main difference between both scenarios?
As of the time that I did my internship, it wasn't really difficult to get through to an internship program here in Nigeria. But from what I've heard from my colleagues that I left in the UK, it was very, very difficult for them to get onto a trainee biomedical scientist lab work in the UK. Some people would go years without actually getting a slot. But over here, when I came back to Nigeria, I came back in late 2007. And I think I had my offer of internship in that same 2007, only that I had a few personal issues that I had to clarify. So I started in 2008. It wasn't really that big a deal. And I met a lot of interns during that year, and nobody from my conversations with them, I don't think anybody really had a tough time getting into an internship slot. However, I think with recently, because of the changes in the courses, a lot of universities, are now offering medical lab scientists courses. I think we were overwhelmed with the number of graduates, so now it's getting a bit competitive.
I mean, when you come back and let's say you were in another country like the UK, the US, and you come back, and then sometimes you tell people here that it's hard to find jobs. Sometimes they don't believe you. And like, let's say they want to go over there, and you tell them, no, it's actually better to study here. They start thinking you're saying that because, I don't know, you don't want them to go, like you want to be the only person who went. But for example, I studied in the US. I know that in the US too, it's quite hard. So why would they go for you when they have Americans there? Like there's an excess of people with a degree.
Don't need all that hassle.
Yeah, exactly.
Exactly. And another thing is, personally, if I had to do it all over again with the structure of the new medical lab science courses here in Nigeria, if I had to do it all over again, I'd probably do it here, because I think the people that graduate from our Nigerian universities are more grounded than we are from the UK. I think they have a more hands-on approach to their jobs and they have more confidence. I would say to you honestly that I think everything that I learned about what I was actually supposed to be doing on my job, I learned on the job. Most of the things I learned in school, I find that I never even used them. It was on the job that I learned the job. And our Nigerian universities are trying so hard to put them on the bench really early. I think they will find it easy to do the job once they get out of school.
When you're on the job that you actually learn what you're
Mm-hmm.
supposed to do. And there's also a difference from moving from one country to the other. Like I'm guessing over there'll be more automation, while here most of the things we do are actually manual. We're trying to
Yes,
move towards automation, but
we're not moving fast enough.
really need to make sure you know all those manual methods because you kind of
But
have
you do
to
realize, but
creatively do your work.
yeah, but it's an advantage. I mean, you would be able to work anywhere you find yourself in. But whereas people that study in the UK or other countries that have gone way, way beyond what we're practicing now, they would find it really difficult if you drop them in the middle of nowhere and tell them to do a blood smear or something like that. They wouldn't know where to start from.
Did you find it was easier or harder to integrate in Nigeria? Because I've spoken to other individuals who studied in the UK and they said it was much harder for them to integrate once they got back because of the internships, because it seemed as if the others were, how do I put that, a bit more advanced, or like they
Ahead.
were more used to working in that environment, and so it took them a lot more work to get to that level. Did you find that that was the
I
case?
totally agree. Yes, I totally agree. I think the advantage that I had was my age. I think because of my degree having been earned at age 24, 25, I sort of, I faced reality early on. I came for my internship and I realized that even students that were coming for their IT were well ahead of me. So I launched myself into the internship program and I hounded my senior colleagues. They gave me lessons, practical lessons. They gave me lectures. They tutored me. So I was able to catch up in no time. But I can imagine somebody doesn't have that sort of support. I think it would be really difficult to integrate back into the system here.
But do you think maybe one of the reasons why it's harder to integrate here is because possibly what you're taught in the UK is a bit more research oriented rather than directly what you're supposed to be using on the job? Like where the labs over there are a little more
Absolutely.
research
I think what
oriented?
they do in the UK, yes, even the courses are more research oriented. What they did in the UK while I was there, I wouldn't know whether they've changed anything now, but what they did was they gave us the tools to be able to apply ourselves wherever we found ourselves in. So what this is, what the biochemical tests are, and this is how they present. Rather, we'd be given the knowledge of how to find we would just be given the overall knowledge, but we wouldn't really go deep into it. And then if you choose an area, I think that's when you sort of dabble into it really well. I don't think they sort of give this the same blanket approval to all areas as we do here. Like, for example, the hospital that I did my internship in, there's a lot of specialty. And from I think ever since I left the internship program, I don't think I was forced to work in another lab apart from micro and molecular. I got to choose what I wanted to do because there were a lot of us there. But I don't think people would have that advantage if they're in smaller hospitals. So you'd have to be able to cover all bases.
Now, speaking of automation, what level of automation have you seen? Like, is there, how do I put that? What do you think is the most crucial thing to automate in our labs in Africa? Well, at least in labs that you've been in Nigeria.
Uh, at the moment, I think we would, of course, biochemistry now is almost always fully automated in tertiary institutions. And I think that should be, a goal to automate our biochemistry labs. We wouldn't mind having a lot of automation in microbiology and hematology as well, because especially microbiology, because the bulk of our diagnosis come from the infectious diseases clinic. And sometimes the turnaround time becomes so slow, and it would really hinder the treatment options given to the patient. So I think we would benefit from that. Overall, we would benefit from a lot of automation if we can keep it up with the power outages and stuff like that. But microbiology and biochemistry, I think.
I've known labs where results, well, could take up to a week, sometimes even a little more, because you have to go through the process and sometimes recheck because you're not completely sure. And so it tends to take a lot of time. I think I kind of know what you'll say, but what would you recommend to someone, let's say, just finishing high school, who's interested in going to study, let's say, biomedical science in the UK? Like, would you advise that? Actually, let me put that differently. In what situation would you advise that, and in what situation would you have advised against it?
At the moment, I would definitely not advise an undergraduate person to go for a degree in the UK. I think they would benefit more from staying here and going through the program here. If they want to go for a postgraduate degree, I would recommend going to the UK, because then they would be able to hone their skills and know that their potentials, and they would be able to be introduced to research methods, which we don't really concentrate on here. So they'd be able to know that they can do so much more with their degree. However, on the undergraduate level, I absolutely would not recommend anybody going. I did go and I made it work for me, but I'm just one person out of so many others. And I was able to see the flaws of the system over there as opposed to the one over here. Like, for example, in the UK, we never touched anything like parasitology. That's why to this day, I still find it challenging for, to see a parasite under the microscope, like if it's a stool or urine sample. I panic because I'm not really good at it. I haven't seen it. I never knew it. So they don't touch on that aspect. Whereas in Nigeria, of course, you do parasitology, and you probably do it for 2 or 3 years. It was such a pleasant. Thank you so much for having me, Robertson.
So, lab experts, I hope you're able to learn a lot from this interview. As you've seen, Hamida was able to study in the UK, but also in Nigeria, and she knows how both systems work. She was able to compare both, and then at the end of the day, determine which she prefers. As she said, as you heard her say, she actually prefers the Nigerian system today. And if you want to study biomedical laboratory science, what she'd advise is for you to start out in Nigeria and then go on to the UK or to other countries for further studies. So once again, I hope you are able to learn a lot. Share this video so that people who are interested in biomedical laboratory science and who are interested in going to study to the UK could have a better idea of how things happen over there. And I'll see you next time to talk more MedLab.